On this episode, we'll talk about dry skin after surgery. We'll also talk about when it's okay to start breastfeeding again after surgery. And we'll talk about the risk of not following your post-op diet. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 225 of the AskDrA show. Really good questions this week. And as you know, we post content every single week, so be sure to hit that subscribe button. That way you don't miss any of our future videos. If you're interested in weight loss surgery, gastric sleeve, weight loss surgery in general, weight loss in general, hit that subscribe button. And if you want to send me your questions for the show, you're more than welcome to do so. There's only one way, all right? There's only one way, and that is using the hashtag AskDrA throughout social media. Please don't forget the hashtag. If you don't put that hashtag, there's no way for us to grab those questions. And I'll be more than happy to be here to answer them for you. All right, so let's get into the show. Okay, so first question is, why is my skin so dry after surgery? And this is a very common side effect after weight loss surgery. And there's two things that you need to keep in mind. Is number one is hydration. I'm not talking about not just oral hydration, but also skin hydration. So don't forget your moisturizing cream, all right? That is very important on your post-op phases because number one, it hydrates your skin. Put it all over your body. Put it on your abdomen, your thighs, all right? Because the moisturizing cream will also, I'm not affiliated to any brand, all right? Whatever brand you like, just use a moisturizing cream. And the moisturizing cream will keep your skin hydrated, but also more elastic, and also helps to have better skin results regarding skin tightness down the road as you lose weight. So keep that in mind. And the other thing is oral hydration. All right, most patients that were not used to drinking fluids throughout your day, you get weight loss surgery, you continue with that habit, and your skin gets dry. So don't forget to stay hydrated and make it a habit. And I tell patients always buy yourself a nice bottle and carry it with you throughout the day. All right, so that way you are reminded to sip weight throughout the day. And it's important to have this method or use an app like MyFitnessPal to keep log of your of how much fluids you're intaking a day. Because if you just set sail and don't have a purpose throughout the day or a goal throughout the day, that's what's going to happen. I mean, you're going to have this day where you're going to be coming out short, and then the next day it happens again, and the next day again, and then guess what? Your skin is dry. All right, so hydration, oral hydration, and skin hydration, those are the two tips for preventing dry skin. Second question is, when is it okay to start breastfeeding again after my surgery? Yes, it is generally safe to undergo surgery while breastfeeding. And according to a physician guide to breastfeeding, patients do not need to pump or discard breast milk after undergoing anesthesia. When the patient is awake, this means that the anesthesia drugs have metabolized out of the blood system and as well as the breast milk. Patients should speak with their surgeons and anesthesiologists prior to undergoing any surgery. Now, general anesthesia should not affect breastfeeding. You can safely nurse once you are awake and alert, and by now or at that point, the amount of medications in your bloodstream is low enough that the amounts in your milk would not be significant. It is recommended to breastfeed, pump, or express right after your surgery or procedure. This will help to keep your milk supply and prevent that pain and the breast engorgement. Now, in our practice, we recommend that you do pump and eliminate the milk that you get 24 hours after surgery. Then you are good. And the reason is the narcotics and medications used during your procedure. Although again, the doses and the amounts are very small, but we like to be on the safe side. Since you have to come down to us for your procedure, it is completely safe to breastfeed your baby once you're home. And the third question is, what is the risk of not following the post-op diet? Wow. All right, hold your horses there. You need to understand that the pre-op diet is designed to shrink your liver and get you in shape for surgery, but the post-op diet, guys, that is super, super important. Please understand, please follow the post-op diet, because if you don't, you are putting yourself at risk. You are putting your health at risk. You're risking having a leak, and it's just 2 or 3 weeks. You know, after 21 days, that stomach is pretty much healed. So just follow the guidelines from your surgeon, keep it to the T, and you are assuring yourself an excellent outcome. And once it heals, you'll get that benefit for the rest of your life of having weight loss surgery. So it is crucial for you to understand that there are risks involved if you don't follow the post-op diet. Follow the guidelines. We have those guidelines for you for a reason. They exist for a reason. The timing for a reason. All right, so keep it by the book and you'll be just fine. All right, guys, so there you have it. That is it for episode 225. Wow, they just fly. Send me your questions. Don't forget to use the hashtag AskDrA. Hey, 70% of you are not subscribed to my channel. You don't want to miss out for future episodes. Every single week, we put out a video out there, and hit that subscribe button. That way you don't miss any of our future videos. Hey, and if you found this useful, these questions were very useful. If you did, if you can leave me one of these, I greatly, greatly appreciate it. Helps us out with the algorithm on YouTube. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.